Welcome to the Health Services Committee meeting. First order of business to approve last month's committee meeting minutes. Motion made by Supervisor McDevitt, second by Supervisor Conover. All in favor?
Aye.
Opposed? Carried. Okay, we have a nice crowd here. Centers is here to make a slight presentation of who they are. So at this point, I would like to turn over to Mr. Rosenberg, who you are all familiar with. Ken, please.
Right there at that mic.
Right at the podium is fine.
Okay, so thank you again, everyone, for hosting us. Last time there were a lot more people, and it was being, I think, live broadcast across the world. So thank you. I was in Lake George this past summer for a vacation, so I figured maybe I could tell you all about my complaints. Is this the appropriate forum? Or
No.
No. Okay, so scratch that. Anyway, we're very excited that the process has moved forward to the point that we hope to close this transaction on December 31st. Hopefully we'll get all the paperwork from the health department in order to do that. It may be delayed a few weeks. It's just perfunctory documents that we have to just go back and forth with. David Greenberg, who is here as well, who you've wanted to meet, was, I know it's a lot of questions on your mind about who he is. He's a gentleman over here, the redhead, and he was always on the application for the transfer. I felt at the time that we made the move that it was the right decision. He'll speak a little bit about that. But David Greenberg and Centers Healthcare are really married to each other, and every nursing home that we have has different ownership structure, but Centers Healthcare is always takes a prominent role in any of our facilities and in any of our transactions and transitions. And so we hope to do as good a job as we do anywhere else to do here in Warren County as well. So I'm going to let David come up, just tell you a bit about him. He's certainly open to any questions, and we'll take it from there. Thank you.
Good morning, everyone. David Greenberg. I know there's been a lot of talk about me, so this is who I am. I've actually been an administrator for close to 19 years, first in New Jersey, where I reside, as well as New York. If you have any questions for me, I'll be very brief, just in some introductory remarks, but I feel more comfortable if you guys ask me questions. This way, you can get an understanding or a feel for who I am. I've been with Centers Healthcare now for 8 years. Before that, I was an administrator for 11 years in New Jersey. Only for 2 or 3 different facilities. I take my job very, very seriously. From the moment I got into this business, it was really always about resident care. That's the type of person who I am. That's the type of person that I was brought up to be. I'm a human being. I'm compassionate. I'm empathetic. And I understand the world of long-term care. I don't know much about other things, including being a great husband and great father, but the one thing I do know how to be is an excellent, excellent administrator who understands the needs of residents, their family members, and how a building is supposed to operate. I guess I was chosen, Kenny's known me now for a number of years, and we looked at these at Warren County together, and it was one of the things that he approached me about, and to see if I'd want to go in on the nursing home deal with him. I was always, part member of the application, and it was only recently that I became, full-fledged, which Kenny could speak to you about if that's still relevant. But at the end of the day, the nursing home across the street is going to be my baby. And my reputation has been such, and you could look, anywhere you can, if you can Google me, or if you could speak to any of the neighbors, the facilities that I've been to. I run a very tight operation, a very good operation, an honest operation, and the residents, the family members, they love me for it. And I'm not asking for you to be warm and cozy with me today, but we will show you in the next 6 months to a year of what Centers and myself can accomplish. And I think ultimately, if we ever get a chance to meet again in a year from now, I think you all will be very proud that the facility is in my hands or in the hands of Centers who we're going to be working with. And this town, this committee over here, will be extremely happy and proud that the decision was made to move forward. So at this time, if you have any questions about me, you can go personal, whatever you guys need to know about me, I will be as honest as I could possibly be.
First of all, we appreciate the entire group coming up here, and we understand that after this, they are going to be going to the facility to meet the department heads and staff and to make their introductions over there. So, Supervisor Brock, may I start with you if you have any questions? This was pretty quick from Friday's meeting that we had this set up, so I don't know if you had any specific questions, or I can turn it over to any of the supervisors.
I just came to listen and...
Okay. Do any of the supervisors have any questions for Mr. Greenberg, or for anybody here?
Maybe you could just, if you could, speak briefly about the kinds of challenges or opportunities that you've experienced when you've taken over facilities, what you might envision here, what Sergeant Jones.
Okay. So I've actually been involved in 2 transitions, both in Brooklyn, New York. One was a 225-bed facility, and one was a 510-bed facility. And you can imagine, whether it's an 80-bed facility or 510, we look at it exactly the same. We go in there, and we start speaking. We start, obviously, with the department heads, and then we go down to the staff as well. And we try to understand, what are the needs of the facility? Why are we in this position right now? What does the facility need? What does the employee need? And when we get an understanding, and sometimes that could take 3, 6 months, when we get an understanding of what's going on in the building, we then sit, around the table in the corporate office, and we decide what's going to be the future. And sometimes we make a mistake. Sometimes we realize, well, you know what? Maybe this department should have been this way, or this should have gone this way. But when we know that we could recognize a mistake, we correct that. And I could tell you very honestly, the 2 transitions that I've taken over, thankfully, till this day, and I can say this honestly, and you can look it up, records, we have very happy residents, foremost. We have happy employees. We have happy family members, and we have good surveys and good facilities. Does something, come up occasionally in a survey? Of course. It's nursing homes. It's long-term care. Something's going to happen. Any operation that's 365 days a year, 24/7, something's going to happen. But we're humble people. We're a humble organization. Understand that when we do make a mistake, we rectify it and we move forward. And I can only say that, the 2 transitions that I've been involved in have been successful. And, I'm constantly in communication with the home that I'm in right now. I'm a 7-day-a-week type of guy. I have excellent people that I put in the facility as well. And we're looking for the same thing to happen over here. Good morning.
I assume Mr. Rosenberg had a staff in his mind that he was going to run this place with. Is that going to be the same staff that you will have, or will there be some changes made?
So like I said, we're starting with the department heads today. We're going to go meet everybody. We want to get our own understanding of what's going on in the building. Right now, what we could see just on paper without looking at people, we plan on retaining all clinical staff in the facility. We also want to meet with all the representatives of the facility just to see what their needs are, what they want to do. Sometimes, people run away. We don't want that to happen. We want to have honest conversations to see who's in the building, what the needs are, and once we figure that all out, we will have very honest discussions with, well, you know what? We think that maybe you'd be best in a facility that we own up in, closer to Vermont, that we think that you'd be great for, because we do have multiple facilities in the upstate region over here. So these conversations constantly happen, but they happen honestly. No one is ever told, in the 2 transitions that I've been with, everyone has left, not that even left, but everyone has felt that we were honest with them. And I think that's the one thing that we could bring to this facility is just honesty and integrity. We're not trying at all to hoodwink anybody. We're just trying to understand that this is the situation, and let's move forward. But like I said, looking on paper, we think that all clinical staff will be retained over here.
I just want to ask, since you mentioned, what I had said, we don't come into a facility with a precondition of, okay, these are the people that we're firing, and these are the people that we have a bus coming up from the city that's going to replace every single person here. We don't have anybody. The purpose of today, after we meet with this legislature body, is to go to the facility and start the transition process. Today is the beginning of the process. We want to meet with the department heads first. We did meet a while ago after the last meeting just to say hello, but that was before the whole process went to conclusion. It's hard to know, who in that facility wants to stay. You could have department heads that are there that are saying, we thank you, but we're going to be retiring after January 1st. They may not want to be with us. We may have expectations of them that are different than what they're used to. So we meet with the department heads and say, okay, the social worker, the dietitian, the housekeeping director, the administrator and director of nursing and recreation, I think I caught them all, and nutritionist, which one of you guys want to stay with us? And now some of them will say yes, and they don't mean it. Some of them will say no, and then they do mean it. So we don't know, but at least the beginning process is today, where we get to see, we are those people that were in the papers. The Post-Star has written more about me, in the last year and a half than I've ever gone in the last 20 years of being in this business. So they need to see who the big bad wolf is, and that's us. It's myself, it's David, it's Amir, it's Jeff, it's Gabe. I mean, Gabe is going to be the regional administrator here. So the administrator who's going to end up being the administrator in that facility is going to answer to Gabe, through David, of course, but Gabe oversees the entire region. So once we have that, we don't want to meet with the line staff because we want the union. We want to work that through the union at this point. We don't want to circumvent, and everybody should think we're trying to circumvent the union. But that's the process. We have nobody lined up for anybody's job.
Any other supervisors, questions? Supervisor Seaver?
Hi.
Good morning.
Thank you for coming in. I've been looking through my notes to see if I could find her name, but at the meeting where we voted on the sale, there was a woman who came and spoke on your behalf. She was, I believe, like head of clinical. She's a nurse. What was her name? Katie. Okay. Great. And I was incredibly impressed with Katie. We have gone back and forth as some residents have come forward who had some concerns. Obviously, things difficult and with the last minute change of the owner of the facility just a month ago. I think it really made a lot of residents, a lot of our community members think very uneasy. So I have been emailing back and forth, not necessarily with Katie, but with someone else from your agency. And I'm wondering, Katie was very informed, obviously a professional, had provided me with a lot of questions, the questions that I had. But will we still have access to Katie? I mean, I found it very difficult to kind of get to her. I gave her my cell phone number, but when kind of pushed me to shove and I needed her, I had some difficulty finding her. And played phone tag with a certain individual. So, is that type of professional, that type of, she spoke about the high level of care that would be provided to residents. She talked about billing and how that would change so that some of these changes would come through billing issues to increase revenue and not cutting with staff or quality to the residents. Is there a way, are we still going to be connected with Katie? That was kind of a big role in my decision.
Right. So when I was going to be the owner together with David, we were going to hire Centers Healthcare, which is much greater than Centers Healthcare is 12,000 employees. Plus the unit declined. We were going to hire Centers Healthcare to be Katie as well as Centers Healthcare. So they were going to be there. Now that it's David, we're still hiring Centers Healthcare. So as far as anybody's concerned, the only difference between today and 6 months ago is that David is 100% the owner of the facility as opposed to sharing it with me. But all the plans and all the personnel and everything else that was going to be before is going to be today and tomorrow, and it's going to be next week. There's nothing in place.
So you think as soon as that plug is placed, I'm assuming she would be Katie's direct contact?
Katie will be here. Katie will be here to do her job as everyone else who is going to come in. She's the director of therapy.
I wasn't aware she was, okay, so she's going to be
She
here.
works for Centers Healthcare. So you
She'll
wouldn't.
be full-time up here?
No, but she's going to do the job. She's going to make sure that the therapy she's going to take the therapy department and put it on steroids and make it really fantastic. I mean, if you have, I don't know how many people you have on therapy, but to do the right care, we're going to put more people on therapy and do the right thing. She is the head of that department. She if you need more staff, it's her responsibility to find it. It's her responsibility to train them. It's her responsibility to do all of that on the therapy side. We also have clinical people on the nursing side and on the social work side. As soon as we finish our meeting today with the department head, I would say, Amir, over the next few weeks, every single department head will have their corporate liaison from Centers Healthcare meet with them to say, okay, tell us about what you need. Do you need more staff? Do you have too much staff? What are your challenges? And then we're going to start bringing those things in. We can't do anything until, we can't officially do anything until January 1st or whatever we close, but the conversations are going to start then.
Okay, and it's so much information, so clearly the last time I didn't have a good sense on what...
Well, the problem is that when everything started to get a
saying that won't occur until after the sale is.
I mean, we can have her come up, we're not
I
in
just
charge.
needed a phone call, so
Okay,
maybe if we can
So let me just tell you a little, just one blurb, okay? Centers, myself, centers. We're trained not to be behind the desk people. We're hands-on people. I run now a pharmaceutical type bed facility. I could just tell you that I would say half of the family members have my cell phone number, okay? I'm not saying I'm going to give out my cell phone number to everybody, but if you need to contact us, if you have an issue with something, we don't just, throw it down, give it to a secretary, call it a day. We're trained, starting from Kenny on the way down, to go and handle issues, tackle them so they don't recur again. Katie is also a very hands-on person. So if you want, you and I right now, we'll call her on the cell phone, I'll introduce you, we could FaceTime her, whatever you need to make sure that you feel comfortable, we want to try to make sure that we do that. Because again, we have even like phone numbers set up that instead of you calling the Department of Health, call us first, and then the administrators get a email that says this person made a complaint, an issue, whatever it is, and we are trained that whether it's Saturday night or Sunday morning, whatever it is, we have to go ahead and call these people because centers, Penny, all of us standing here, we're all hands-on people that have to tackle issues. So Katie is just that person. She's been with the organization for many years, and she'll be that person. And she was really honest when she said, any issues that come up with family member residents, we will handle them. And she was honest about that.
Like a patient advocate, and I was just hopeful that I think it was because the sale was pending, but I will connect with you.
We're large enough to be corporate, but we're small enough that and again, this is a Katie story, she will call me to tell me that you have to buy a splint for X resident because this resident needs it. And it's not something that we just go through purchasing. If we have to take petty cash to go out and get it in this local store, we will. And if we call purchasing in centers and they have to overnight it, that's what we do. And that's something that Katie does all the time with our residents.
It's a therapy side.
Yeah.
She's the clinical director of therapy services. There's a lot of people who work on the other two visits. She's on the road all the time, and we have 3 other facilities in this area, so she's here all the time. If you want to meet with her, David will arrange. You can just call for me. We'll tell her you need to meet with Rachel, and the one who's providing us. So she'll be more specific to you, and have coffee at night with you. I mean, this is what she does.
What she
Her
does.
I
and
must
her
not have
dog.
gotten
Her and her dog.
Well, I'll get it
You
from you.
or cat, all you want.
My second, I'm really more concerned, not necessarily about the dogs and the cats, but the people at the facility, as we all are. And that direct connection was something I was looking for. My second question is, and I'm sure people have a lot of questions, but my second one comes from this change, this last-minute change right before the sale, made me incredibly uncomfortable. And I just wondered if you could talk a little bit about that.
First of all, don't be uncomfortable. There's nothing to be uncomfortable about. Kenny, if you want to, decide. I mean, it's, we could.
When this process was going on, got a tremendous amount of negative. I got a tremendous amount of negative publicity, warranted or unwarranted, in respect. Okay, and take it. But I knew that in front of the health department, when we would be up for review, that we would be holy hell raised on us for no good reason or for good reason or whatever. So you know what? It's going to be a distraction. Sideshow. The main purpose here is to get the facility moving in the right direction. But you know what? Let me remove myself from this. Okay. David, who's originally going to be on it anyway, let him take the full reign. Aside from that, I have a lot of things on my plate. So it's a great opportunity for David to really, grow into this role and bring forth tremendous support of Central Healthcare. We still be up here under the again, it's called Food Care. So it seemed like a simple way to avoid the distraction. And we give David an opportunity to do that. Nothing's changed on the west before.
I know that's been a conversation in this room probably, but I could tell you that once you get to know us, and hopefully you will see that this is business as usual. This is something that happens. This was not something that we're trying to, throw David Greenberg in. I'm a real person. I was on the paper beforehand. I'll be here now, and with the support of centers. I think really, it's a question that should be asked, but I think it should be put to rest. It's really non-relevant. We're here for patient care. And again, looking at what we could do clinically in this building to make it a shining star for our organization.
Supervisor Brady?
Yeah, thanks. first of all, thank you for coming up, Mr. Greenberg. But I just can't, let something slide very easily. You know, here we are on this whole long process. Mr. Rosenberg comes up and gives a fine 3-hour presentation. I will be accountable. I'll be the person responsible for taking care of your elderly, because that is my biggest concern. Those people over there, the elderly of Warren County. So we get the big show, does a fine job. He's done a lot of presentations, I can tell, and he did a fine job. So all along, we're led to believe in this boardroom that Mr. Rosenberg is going to be the owner. 6 days before the Department of Health meeting, our leaders don't inform us. We inform our leaders that we've been told that there's going to be a change in ownership. That's very disconcerting to me. Very disconcerting. So all along, I'm thinking Mr. Rosenberg's going to be the owner, whether I agree with some of his past history on some of his care at his nursing homes or not. At least I got to meet the man. He took the time to come up here. I respect that. And then at the last hour, 11th hour, Mr. Rosenberg's out. He sold his shares for $10. Well, new guy. Now, you were on the application, I understand. But how many times have you been up here, Mr. Greenberg? Can I ask you that first?
I was here once before.
One time. When was that?
Last year sometime. I mean, before the summer.
Who did you meet with?
Just to look at the nursing home.
Okay,
Just
so
look at
you
the
came
area.
up one time. Did you meet with Lloyd?
No. Well, we met, Lloyd came down to visit, our facility
But
just to see.
did you meet Lloyd
No.
over at Westmount?
No.
So you came up to Westmount one time, a year ago, didn't meet with the administrator, okay? So now all of a sudden, you can see my concerns, okay? At the 11th hour, I'm thinking Mr. Rosenberg's gonna be the owner, and now a guy I've never met, never heard of, no one's ever met, is now gonna be the owner in care of our elderly. That is very disconcerting to me. I can't be any clearer than that. Now,
let me,
no.
So let me just.
I don't think I'm done yet, though. I don't think I'm done yet. So, going forward, that Westmount has a 4-star rating. Can you guarantee me that you're going to maintain that 4-star rating? Can you assure me?
Okay,
Because your track record on the 2 facilities that you're on is a 1 and a 2-star rating. Now, maybe I'm incorrect, but that's the data I have. So, what I'm looking at is you're going to be the owner, 100%. You've got 2 facilities that don't have good star ratings, and you're going to be taking over one that has a 4-star rating. So now do you see where I'm coming from?
I'm the managing member of those 2 facilities that have the 1 and 2-star ratings, so you should be thrilled that I'm removing myself, and then he, who runs, how many stars is Borough Park Center? So his facility that he runs, 500 beds, is 4 stars, so he should actually do a better job than me.
So we should have had him all along, is that what you're saying, Kenny?
That's exactly
Should have
right.
been fired from day
No,
one?
the truth is, I understand your frustration, but we're here today. We would like to, and I mentioned this, the last meeting that I was up there for 4 hours was really, it was a beat-up Kenny meeting. The original time I came, so that was a pleasant meeting. That other meeting was pretty rough, really, really rough. It gave me a lot of sleepless nights. It was standing up there for 4 hours, getting peppered with some questions was brutal. So, but we're here today. What can we answer to you to make you feel better?
Well, first of all, I didn't feel that 4-hour session was a brutal session at all. If I look, I thought it was a fair vetting, and when you're talking about the most vulnerable citizens in our county, I thought it was more than fair that we get a little fear for you, Kenny. I'm sorry you felt that way. I sure as heck didn't. I didn't feel it was a tough.
I was the one up there.
Yeah, I know,
So.
and I've been in a lot of meetings myself, and I've been in tough meetings, and that wasn't one. But anyway,
I hear you.
we can
I hear you.
debate that. So one of my things is I just asked Mr. Greenberg, what assurances do I have as a supervisor that this is going to maintain the 4-star rating? I mean, a year from now or 2 years from now, am I going to have buyer's remorse, seller's remorse rather, and say, hey, the rating's gone down to 3, it's gone down to 2, it's gone down to 1. What happens then?
So let me just ask you a question. I think Kenny just hit on it first. And I'm sorry, what's your first name?
Doug.
Doug, how are you? What could we say right now? What would you like to hear from us right now that will put your mind at ease, that you don't have seller's remorse. And what I'm here to say, and I said it in my opening remarks, is that today, I don't think that we're all going to walk out high-fiving each other, and this was the greatest deal, and, you know, they came up, and now we're okay. You have to let us do our job. You have to let us do what we've done before, what I've personally done before twice in very large facilities, that I am confident that I could do in this facility. Yes, I agree with you. What the newspaper is reporting and what came then in the last hour, all of a sudden, David Greenberg, I know what it sounds like. And I'm not here to trick you to think that it was not. I'm telling you honestly, there was nothing that we were trying to, hoodwink anybody from the situation. The situation is thus right now that I am the, sole owner of this facility. I plan on hiring centers to assist and, with all the, clinical arrangements that we're trying to make over there. And I want you to understand that you have me here present, okay? I will give you my cell phone number afterwards, okay? You will see me coming up here as much as it takes for me to come up here to make sure that this building is running. Because I don't sleep at night when one of my residents is upset, when one of my residents is not getting, good care. You ask me, what assurances do you have that it's going to maintain a 4-star? We don't have any assurances in life. I don't know what's going to be tomorrow. I don't know if, Corning and Steuben will come 5-star tomorrow. But I could tell you that I've been in this business for 19 years. The Department of Health is very, very important, and surveys are very, very important because it's what people look at and what we have. But I always question, when you get a bad survey, sometimes it could be for like a minor, a ceiling tile was stained, or a pipe, or a care plan issue. Ask the resident, ask Mrs. Johnson in the bed, are you being cared for properly? And if she says no, or something happened, David Greenberg will come up to make sure to see what's going on. And I could tell you that with the assistance of centers, with myself, with everything that we're trying to do with your current staff that's there right now, okay, because they're going to be responsible for maintaining that 4-star as well. We are trying to make this place a shining star for this community, because we want our reputation and reputation that you've given in that facility to be one of exemplary. And that's what we're going to try to do. And again, I can't give you any assurances today, but maybe in a year from now, 6 months from now, whatever it is, you will say, you know what, they're not such bad guys after all.
Follow-up question. Staffing to elderly, consistent staffing to elderly, I believe, is a main factor in the care of the elderly. Now, I'm not a professional expert, health expert. What turnover rate are you anticipating at Westmount in the first year?
Okay. Like I said, we didn't go in there. We're going to start the transition process today, just speaking to the department heads and seeing what's there. What I think we've seen on paper right now, we don't assume at this point that any clinical staff is that everyone's going to be retained. That's clinical staff member over there. Like I said, we're going to look at the situation. We have to see the whole big picture, okay? And we want there to be good reputation. We know that Department of Health is looking. We know that you're looking. We know that the family members there are looking, and we know that there are vulnerable residents in bed, okay? We maintain the highest level of quality for all our homes. We start, like I said, with Kenny, and then it ends up with us. But we have things in place right now to assure that our residents are being cared for. And again, that's what I've done for 19 years. And my track record is pretty much perfect, okay? Thanks. It's pretty much perfect that I maintain good surveys, and we give good quality care. And when the hiccups happen, which they ultimately do, okay? It's inevitable. They do. But we're there, not to just yes the family members and the residents and the legislation. We go ahead and we try to make changes, good systematic changes, to make sure that these hiccups don't happen.
I would answer the question by asking you, like, how many of the employees that are there today turn on pay? How many turn on leave?
Well, it depends, I think, on what type of financial package you offer them and so forth and so on. Let me ask you this question. What's your typical turnover rate in the first year when you take over a facility?
That's a loaded question because we've done so many, it's impossible.
You don't have those figures?
Amir.
I mean, you're a sharp businessman.
No, but each facility is so different.
I understand.
So
I'm just saying an average. That's all I'm asking.
because some facilities are overstaffed, and some facilities were overstaffed by tens of people, some are understaffed. So, I mean, what's our general history here?
For the last county transition,
whether employees, there were a number of employees who decided to leave to get a retirement package or to go on unemployment as opposed to working. That is beyond our control. So we definitely have to work with the facilities and the department heads to ensure that all the employees, we want as many employees as possible to retain the quality staff, retain their staff. The actual turnover percentage, that's not something that we track. But I'll tell you this, a lot depends on yourself, because at some point, we're gonna have to have a liaison to the county, and we're gonna work with them, and you're gonna offer them a package to say, well, how many of you are, you're welcome to come back and work for the county. If you have an open slot, are there jumping rights? Let's say you have a CNA who works in the county, as a CNA, and you have a position in the landfill, or wherever you have a position. They would say, I wanna stay with the county, because I can tell you for sure that your benefits are better than whatever we're gonna give, because it's a county job, and that's why people work for the county, and for government in general. So how do I know that the nurse is not gonna leave to work in the landfill? We had that in Fulton County, a nurse left, we were offering her more money, and she went to the landfill in Fulton County because the benefits were better.
And I understand that thought process. That's more of an anomaly in the minor, a very small percentage. Well, I think so. I think I've
Well,
looked
it
at the numbers.
depends what they're offering.
So the bottom line is then, you can't tell me what you anticipate as a turnover rate. You don't know. And let me finish before I get interrupted, please. And that you can't give me any assurances that we're gonna stay 4-star, but you're gonna do your best. And I think you're an honorable and sincere man. I'm just sensing that just from our brief 30-minute exchange. And I hope and I pray that you're gonna be a man of your word, and you're gonna keep that home up to the high standards and consistency with staff that we currently have. Because I know Lloyd does an excellent job over there, and that is my priority, to make sure that this does not go backwards. It cannot go backwards. It's not acceptable to go backwards. That's where I'm coming from, so thanks for your time.
No problem. Thank you.
Any other supervisors?
Just one more, if you don't mind.
Go ahead.
Just about, I had a couple people from the nursing home approach me about the difference between a contractor and employees, and their fear was that the number of contractors would increase significantly. I have to admit, not really well versed on this, and I'm just wondering, what your experience is with that, or what the intentions are with the contractors.
What's your contract?
Like, is it someone that's not a full-time employee by the county, but is on a per diem basis or a contracting basis with the nursing home?
We like to have full-time employees. We don't like, you go about agency people, we don't like those. We like it to be full consistent staff that's in place. Do you have that now, contract and agency?
Lloyd, it's my understanding it's contractors, right?
Yes, you use some agency staff, and you recently hired the unit managers, which was tough to get the RNs, we settled on those, the education coordinator. A lot of the people that we were talking about here have already either left the county for a county job. And a lot of the key people there are new, because of this transition that's taken place. It's taken longer than we thought. I've been over there 2.5 years, and when I was hired, it was already a done deal that this home was gonna be sold. So it's been 2.5 years in the making. So the staff has heard about this for a long, long time. And we're finally coming to the end of it, where they're gonna have something concrete to talk to hear from, here's where we're going, and here's our marching orders. So, when I came in, it was a 2-star building. And now we're a 4. You can lose your star rating in a heartbeat. It's not a guaranteed thing.
You can give away the raise.
And thank you for all that information, but
Right now,
I
the
just have a question about
agency, to get back to
people that are
the agency,
contracted.
So the answer is that we don't know until we get there. I'll tell you this, there are certain counties that we're in, and this one may be one of them. There's a tremendous shortage in CNAs and LPNs. And so we have the statistics and the actual numbers of how many licensed personnel within the department. So we know how many nurses live in, let's say, Warren County, and we know how many physicians there are in Warren County, or in Fulton County, or in Essex County, or in Washington County. And we know there aren't enough to fill all the spots. Right? There aren't enough people. That's why people use agencies from out of town, because you have no choice. There are just not enough people. So hopefully that's not the case here. We'll look at it. We'll start looking at it now. We're going to have real conversation with Lloyd. We have to ask Lloyd if he's going to stay. We don't know if Lloyd even wants to stay. So when we get back there, we're going to have some conversations, not in a public, but just Lloyd, what's the story?
If you give him the raise you wanted us to give him, he'll probably stay.
Well, so now we're negotiating.
But I think then you must be very excited about what's going on at SUNY Adirondack and the possibility of an engine on this building to really focus in on nursing costs and a lab and so many opportunities from nursing up to the shortage that we're seeing across the state.
Problem is that, long-term care is not a glorious position, especially, but yes, the answer is yes. How long will it take most of those
Right.
places? But, we'll work with you if you know of any at least that we can work with. Of course, we have to see if there's real problems, then you have to tell. So,
Thank you.
Anyone from the public would like to ask? Please just state your name and
So I was born in Queens. I grew up in Queens, New York, and I actually just celebrated my 40th birthday last Thursday. So, 40 years old. I live now in Bergenfield, New Jersey. I have a wife and 4 children.
Sir, Sam? I'm sorry. We'd like to have speakers speak only about 3 minutes, okay? So I know you said you had a series of questions. Can you? Please, thank you.
I don't...
I haven't listened to his lawyer question. I mean, I could, but it's not our job. Well, how come you are no longer part of the franchise? We addressed that already.
Actually, it's an LLC, and I'm part of an LLC myself with my restaurant. I can change members as I wish. That's under our purview. I actually applaud them for doing so. They did not have to tell us that they were making a change, and they did so.
That was done.
When all that is done, how come the rates of psychotropic drugs are 2 to 3 times state average, sometimes better than drug like
Actually, sir, Sam, I hate to interrupt you, but your 3 minutes is up, so we're gonna stop at that.
I like the question answer and people buy it.
I'm not gonna take that. Anybody else from the public? Travis?
Good to see you. Thank you. First of all, I'd just like to bring up a couple of things that were in the application that I read the other day. And in it, in the financial side, how they're going to make ends meet is the biggest focus there is that the benefits that the county pays to the employees that now work over there are twice what they feel they need to pay. So I would think that once you cut people's benefits in half, you will probably have a good number of people see if there's other spots around here that might do better. The other part of the financial piece that struck me as very odd was the amount of rent that'll be paid by Mr. Greenberg to Mr. Hagler. And it's $550,000 a year on what, we sold the building and land to Mr. Hagler for $1.5 million. So it seems like a tremendous amount of money. If you had taken out a mortgage at 5%, 30-year mortgage, where you would actually own this facility at least eventually after 30 years, you'd only be paying $100,000 a year. Instead, they're paying $550,000 a year. And it seems like maybe some of that money could have been spent more on the employees to keep them a little happier. There may be a shortage of CNAs, but it's fully staffed over there now. There may be a shortage after you cut their benefits in half. And those are my concerns, and maybe you can, respond to them. Thank you.
This is round 3 with Travis. It's a pleasure. We do this every time. The Department of Health application that was submitted takes into account certain assumptions. We don't have all the information, but we've been doing this a long time. When we get in there, we're going to look at the employees. I'll give an example. So we'll take a look at the employees' rates of pay and benefits and say, well, maybe what was presented is not 100% the way we thought it would be. We want to tweak it a little bit. And so people that are there may end up with one set of benefits and rates of pay, and then the people that have not been hired yet or have never worked there before that will need to be there because somebody retires may have a second set of benefits. Let's not forget that the county is losing probably close to $1 million a year. So we certainly didn't buy it, Mr. Whitehead, to lose $1 million a year. At least we want to try to make it break even, and then hopefully it's a business transaction, hopefully make a few dollars. Everyone has a job as well as you do. You make money, so it has to make sense. So can I talk to every single item on the application? No, but that's a general consensus, general idea of how we do things.
Supervisor McDevitt?
Yes, Mr. Chairman. I'd like to maybe echo what Travis said, and the thing that really stuck out to me in your application to the state of New York was the ground lease to basically suck $550,000 a year out of the day-to-day operations of a nursing home, dollars that could be used to pay for caregivers on the front end, to suck that out of the transaction and to give a rate of return that fundamentally pays an investor off in less than 3 years. It is, in my opinion, legalized robbery. And I'm surprised that the state of New York has not taken a closer look at these type of ground leases.
Supervisor Simpson, did you have a question?
Yeah, I just wondered if the name was going to stay the same, Westtown, or will you guys be changing it?
It will probably be called Warren County Centers for Rehabilitation Healthcare. Warren Center. Warren Center.
We have been noticing they're having a little trouble with the name healthcare recently in general because it's being vague. So probably we have a name. Do you like that name? Yeah, I just wondered if it's... We wanted to keep the history.
Supervisor Westcott?
Thank you.
I wasn't gonna ask any questions, but I'm curious now after hearing Travis and Peter speak. You're gonna have trouble, cutting costs. You know, you've got a tough industry. You know going into it, that's an issue because it's losing roughly $1 million a year. So why would you take out such a big lease when you could buy the darn thing and take out a 30-year and you could save $300,000-400,000 a year just on that alone? Why paying such a big lease when you have other options that could save hundreds of thousands of dollars annually? I'm just curious about it.
So it's a business decision that was made at the time. It's private information, but I think we should leave it at that.
Sure, you can leave it private, just very curious, very odd. Thank you.
Okay, anyone else? Okay. I just want to make sure no one else has any other questions because I was accused at the last meeting that nobody had a chance to thoroughly vet.
Some of us didn't.
Okay, I would take a motion to adjourn then. Supervisor Conover, second by Supervisor McDevitt, all in favor?
Aye.
Opposed, carried. Thank you.
Are we going over to facility